Thank you, everybody, for joining us here at the County of Santa Clara Vector Control District. We're going to get started momentarily. My name is Sean Woodland. I am a communications officer with the County of Santa Clara Public Health Department. Today, what we're going to be doing is we will have some brief prepared remarks from our spokespeople here, first in English, followed by a short Q&A session. After that, we will repeat the process in Spanish. So we'll make sure that we're servicing both our English and Spanish-speaking media. Speaking today will be Edgar Nolasco, the Director of the County of Santa Clara Consumer and Environmental Protection Agency, Dr. Nair Zahiri, the Manager of the Vector Control District, Dr. Sarah Rudman, the Acting Health Officer and Director of the Public Health Department. And then speaking in Spanish also will be Edgar Nolasco and Dr. Krishna Sharasi, the Acting Communicable Disease Controller for the Public Health Department. And with that, I will hand it over to Edgar Nolasco, the Director of the County of Santa Clara Consumer and Environmental Protection Agency. Edgar?
Good morning, everyone. Thank you for being here today. I bring to your attention an important matter, an important public health matter. The first detection of the invasive Aedes mosquito for 2025 in Santa Clara County. This is the first detection in 2025, which means it survived in the winter of 2024 when we detected it in this county. This mosquito is tiny, but it has a massive impact to the community and the health of our community. This is a day-biting mosquito, highly aggressive in nature, and it has the capability of transmitting diseases such as Zika, chikungunya, dengue, and yellow fever. Viruses that are not native to our area, but have the potential to have a health impact to our community. I'd like to share some items as takeaways. Our early detection means that we have the possibility to controlling its spread and empowering the community to work with us to ensure that this mosquito doesn't spread and have a health impact on the community. Your yard can be a breeding ground. Everywhere where you look, any item that can hold water is a potential breeding ground for this mosquito and Aedes aegypti. We are asking the community to collaborate and partner with us to ensure that this mosquito doesn't get a bigger foothold of our community and change the quality of life in our county. The community is our first line of defense. Please ensure that you work with us to allow our vector control technicians to provide free inspections and advice on how to reduce the spread of this invasive, aggressive mosquito known as Aedes aegypti. I want to thank the community member that called us and reported this mosquito to us. Again, it shows the importance of the community being a collaborative partner with us. Through a complaint of a community member, we were able to early detect this Aedes aegypti in 2025. Let's protect our community, our health, and our quality of life. And thank you for being here.
Thank you, Edgar. Up next will be Dr. Nair Zahiri, who is the Manager of the Vector Control District. Doctor?
Good morning. My name is Nair Zahiri. I'm a Vector Control District Manager. What's happening? The threat of this dangerous mosquito is growing. This is the second year in a row we have found the day bite mosquito in Santa Teresa neighborhood of South San Jose. Last year, we found about 388 of this mosquito in San Jose, Santa Clara, and Gilroy. The fact that they are still present in South San Jose means it is becoming more likely that this mosquito is here to stay. That's why it is important that ever for the community to help stop the spread of these aggressive mosquitoes. What we need to do, as Edgar mentioned, report any day bite mosquitoes. This mosquito is biting during daytime, inside and outside. Dump and drain any container might have a small little water. Mosquito is able to lay eggs in a small container. If you need more information regarding notifying on treatment and invasive mosquito, please subscribe to our alert system, Alert SCC. And the more important, please grant us our licensed technician. Check your backyard and front yard. They are expert to find the mosquito source and control mosquitoes. I appreciate, thank you so much.
Thank you, Doctor. And finally, to conclude our prepared remarks in English, Dr. Sarah Rudman, the Acting Health Officer and Director of the Public Health Department.
Thank you so much for that introduction. I just want to speak to the inflection point we're at this moment, where we have the ability as a community here in Santa Clara County to make a difference and to decide whether this mosquito is going to be allowed to stick around and spread disease in our community. So right now, we know that the risk today of somebody getting one of these diseases, like Zika, dengue fever, chikungunya, or yellow fever in our community is effectively zero. Because what we need for that to happen is both this mosquito to be in our neighborhoods and somebody who is sick with one of these diseases to be bitten and then have that same mosquito bite a new person. And that's how these diseases are spread from person to person. Up until now, we have always had people returning from other countries where these diseases are endemic back to our home in Santa Clara County. But we've also seen that number increase. So in 2020, we had just 7 cases of dengue acquired outside of Santa Clara County, found here at home. Last year, that rose to almost 50, a 7-fold increase in people who got dengue outside of our home and brought it back here. But what's changing now is if this invasive mosquito becomes endemic here, eventually these diseases will spread here at home, causing severe risk, including risk of death, to certain populations. These diseases are especially risky for pregnant people, for young children, and for older adults. So that's why I'm hopeful that as a community, we come together, help our neighborhoods follow the 4 simple steps that my colleagues in the Vector Control District have described. We ask you to report day-biting mosquitoes, to dump out any areas of even a bottle cap size of water in your area, and to let our mosquito experts help in your neighborhood. So if you see my colleagues from the Vector Control District, thank them for their support in getting rid of this dangerous mosquito in Santa Clara County.
Thank you, Dr. Rudman. Are there any questions that the gathered media has or that our spokespeople can field for you? The question is, where was the first mosquito found or reported? Edgar, do you want to take that or? Okay.
In 2025, we monitored this 6 area and we did not find any. But a week after, one of the public calling us and complain about the day-bite mosquitoes. We set up traps and we find 2 adult mosquitoes. That is the way we find out. And for sure that because the winter time, they were survived, and those are from last year, they survived this year. It is in Santa Teresa, South San Jose, yes.
Neighbors, the community down there.
So the question is, what are the steps that we take after the detection? Dr. Zahiri?
We find this mosquito, it means we have different approach. We are increasing our monitoring surveillance team. They move more traps in that area. We increase our outreach, community outreach, and also we do more control, door-to-door inspection. And also we are let the public know to let us know if there is any day-bite mosquitoes. And also this year we are working with the other vector control district. They have Aedes aegypti, and also working closely with public health. Yes. It's about 100 meters from the finding, and we set up a lot of traps because this mosquito is not flying that far.
If there are no other questions, we'll move on to Spanish. So up first will be Edgar Nolasco, the Director of the County of Santa Clara Consumer and Environmental Protection Agency.
Buenos días a todos, mi nombre es Edgar Nolasco, soy el director de la Agencia de Protección Ambiental y del Consumidor. Gracias por estar ahora aquí. Tenemos un mensaje muy importante sobre el mosquito agresivo conocido como Aedes aegypti. Esta es la primera vez que se encuentra este mosquito en el año 2025 en el condado de Santa Clara. Este mosquito se encontró el año pasado y sobrevivió este invierno, diciendo que se está agarrando más porcentaje en nuestro condado. Y necesitamos la ayuda de la comunidad para eliminar este mosquito, que se haga un problema más grande en nuestra comunidad, porque ese mosquito tiene la posibilidad de transmitir ciertas enfermedades muy peligrosas como Zika, fiebre amarilla, chikungunya y dengue. Necesitamos la ayuda de la comunidad que nos deje hacer nuestro trabajo y que reporte esos mosquitos a nuestra agencia de Vector Control. Y cuando miren nuestras camionetas y miren nuestros empleados del Vector Control, que dejen que nuestros empleados puedan hacer su trabajo inspeccionando sus casas y asegurar que no haya ningún frasco o cualquier cosa que pueda detener agua. Las cosas que pueden detener agua ayudan al Aedes aegypti que ponga más huevos y que sea un problema más grande en ese condado. Si no actuamos ahorita, ese mosquito va a cambiar la calidad de vida en nuestro condado y puede impactar la salud de la comunidad y nuestra familia. Muchísimas gracias.
Next, we will have Dr. Krishna Sarasi, the Acting Communicable Disease Controller for the Public Health Department.
Buenos días. Estamos aquí hoy, el Distrito de Control de los Vectores y el Departamento de Salud Pública del Condado de Santa Clara, porque todos en nuestra comunidad tienen la oportunidad de proteger a su familia y a sus vecinos, porque hemos detectado este año, por primera vez este año, un mosquito invasivo que tiene la capacidad de transmitir enfermedades que no suelen ocurrir aquí en los Estados Unidos. Y estas enfermedades son potencialmente graves. Entonces, si estos mosquitos se hacen común en nuestro condado, vamos a ver los mosquitos no solo algo molestante, sino un riesgo serio para la salud. Entonces, estamos pidiendo a todo el público que colaboren con el Distrito de Control de los Vectores para eliminar los mosquitos invasivos que tienen la capacidad de transmitir estas enfermedades y proteger a su comunidad, a sus familias y al condado en general. Gracias.
Questions? I just come up so you can hear the question.
La pregunta es, ¿dónde se encontró este año el mosquito? Este año 2020-25 es la primera detección que hemos tenido de este mosquito y es en el área del sur de San José, en la área de Santa Teresa. Ese es el mismo lugar donde el año pasado encontramos ese mosquito. Tuvimos un reporte del miembro del público que miró este mosquito, lo reconoció y nos llamó. Le quiero dar las gracias a la comunidad y ese miembro del público que nos llamó y hizo la importante cosa de hablarnos y contactarnos. Eso nos mandó el distrito de vectores a poner trampas y saber qué tanto mosquitos hay ahí. Ahorita hemos encontrado 2 y estamos pasando por la comunidad, yendo a casa, haciendo inspecciones gratis y con la ayuda del público y nuestros empleados de expertos de mosquitos en el distrito de Vector, vamos a poder juntos a combatir este mosquito que no se haga un problema más grande en la comunidad.
Las enfermedades transmitidas por este mosquito invasivo Aedes aegypti, incluso el dengue, el chikungunya, el Zika y también la fiebre amarilla, los síntomas son similares entre las 4, incluso fiebre, dolor de los músculos, dolor de las articulaciones. El dengue y la fiebre amarilla muchas veces las infecciones son más graves, pero para saber cuál infección uno tiene, mejor ir a su médico y sigue sus instrucciones. Y es importante subrayar que hasta hoy no hemos visto la transmisión local de estas enfermedades, solo la presencia de los mosquitos que transmiten estas enfermedades. Pero si estos mosquitos se hacen común aquí, en tiempo vamos a ver transmisión local de estas enfermedades, pero hasta ahora solo hemos visto estas enfermedades después de viajar a un país internacional. Como muchas infecciones, estas enfermedades afectan más a los bebés, a las mujeres embarazadas y también a los de mayor edad. Bueno, si un mosquito te pica durante el día, por favor, llame al distrito de control de los vectores para que puedan hacer una investigación. Y si alguien tiene síntomas, mejor hablar con su médico para saber si tiene que ir a la oficina de su médico normal o a la sala de emergencia. Las enfermedades graves de estas enfermedades, por ejemplo, el dengue y la fiebre amarilla, sí a veces causa infecciones y enfermedades graves hasta la muerte. Ya no hay de qué.
Thank you so much for joining us. Thank you for everybody who watched us online. With that, we will conclude today's press conference. Thank you.